All right, so now we're going to look at Zika virus. You may remember an outbreak of this a few years back. This is an RNA virus, and it can cause a microcephaly, which is a baby that is born with an abnormally small head. Zika is part of the Flaviviridae family, and so it's related to dengue fever, West Nile, yellow fever. This is vector-borne from the mosquito, of course, and it can also be contracted through sexual contact or via a blood transfusion, okay? The symptoms can range from none to a skin rash, conjunctivitis, muscle or joint pain. It can trigger Guillain-Barré syndrome in adults. Babies acquire it during gestation will have Zika syndrome, which means they can have this small head, vision problems, involuntary movement, seizures, irritability, symptoms of brainstem dysfunction, difficulty swallowing. This is, of course, transmitted via that mosquito bite, the Aedes mosquito, and occasionally through sexual intercourse with infected individuals, and then vertically in utero. It rapidly spread throughout the Americas. There were 175 cases in the U.S. in 2017, 174 in travelers returning from affected areas. One was through sexual transmission. Prevention, well, there's no vaccine currently available. Treatment is going to be supportive care. People experiencing Guillain-Barré syndrome sometimes need physical therapy or mechanical ventilation. There are strategies to impair mosquito reproduction being researched, mosquito nets, those types of things to prevent. Next is Polio Myelitis. This is in the family of Picornaviridae. The genus is Enterovirus. It is named for its small size. Pico is small. This is a non-enveloped, non-segmented RNA virus. It has a naked capsid which confers chemical stability and resistance to things like acid, bile, detergents. It can survive the gastric environment or other harsh conditions. It's transmitted primarily with a fecal-oral route. Contaminated water. So it can be asymptomatic or with a mild headache, sore throat, fever, nausea, but it can also enter the central nervous system, infecting and destroying neurons. It multiplies in the oropharynx and intestines. The acute enteroviral infection of the spinal cord can cause a neuromuscular paralysis, and this can also be called infantile paralysis. The World Health Organization campaign has greatly reduced the incidence of polio, but no civilization, no culture has actually escaped its devastating effects. In 2014, India was declared polio-free. It was declared a public health emergency by the WHO organization because it had spread to Africa and the Middle East in 2014. It has a short-term mild viremia. It can have mild, non-specific symptoms, fever, headache, nausea, sore throat, myalgia, which is muscle pain. But if the viremia persists, then it goes to the central nervous system through the blood supply, spreads along very specific pathways in the spinal cord and brain, and it has a neurotropic infiltrate that can get into the motor neurons of the anterior horn of the spinal cord, and it attacks spinal ganglia, cranial nerves, motor nuclei, and so this can cause some severe issues with muscular paralysis. People were in wheelchairs for life. They're handicapped. Their muscles deteriorated greatly. They were often the muscles, the diaphragm would be affected, and so they would have to be put in an iron lung. So this can cause what's called a flaccid paralysis. We have two types of flaccid paralysis. We have a rigid paralysis where the muscles contract and stay tight forever. Well, I say forever, but through the course of the disease, and then a flaccid paralysis, which is just a limpness. Okay, they just don't function at all. And so this invades the motor neurons and causes that flaccid paralysis of the legs, abdomen, back, intercostal muscles and diaphragm, as I was referring to earlier, pectoral girdle, bladder. We have a bulbar poliomyelitis that can affect the brainstem, medulla, or cranial nerves, and that can give you loss of control of your respiratory functions, your respiratory regulatory centers. Okay, so this is when you would need that iron lung or mechanical respirator. Iron lung was back when it hit the United States in the early 50s. My mother actually had polio. Let's see, maybe it was 40s. She was about 12, so late 40s, early 50s. And so those muscles will begin to atrophy. The growth will be slowed. So she has one leg that's this much shorter than the other because it stopped growing. And so it can cause severe deformities of the trunk and the limbs. And limbs are going to be crippled, often very painful. We even have what we call a post-polio syndrome, which is where as they are reaching, this is the, what's the name of the generation? It's the me generation, but oh goodness, I can't think of what it's called. We had the big baby boomers. This is the baby boomer generation was affected by these. And so they are all kind of aging out into geriatrics now. Like I said, she's now in her 80s. And we have what we call post-polio syndrome, where they're seeing some neurological muscular control issues that have kind of chronically developed or reside, not really have a full understanding of that. But it is a very serious issue. So after ingesting through that fecal oral route, the poliovirus is going to attach to receptors in the mucosal lining cells in the oropharynx and intestines. And there they're going to multiply in the epithelial cells, lymphoid tissues. You're going to have very large numbers of virus that's going to be shed in the throat and in the feces, okay? Some can even leak into the bloodstream. So depending on the number of viruses in the blood and the duration of the time that they stay there, individuals, that's what gives you such a variety in their symptoms. So individuals can have no symptoms, they can have mild symptoms, or they can have that devastating paralysis. It can also be spread not only through fecal oral, but contaminated water, objects contaminated with feces, mechanical vectors as well. In the 20th century, we did see that large rise in paralytic polio cases. This is also the century that we developed a very effective vaccine. We have two vaccines we're going to look at. So the infection was eliminated from the Western Hemisphere in the late 20th century. So it's basically eradicated in the developing world, but in the, it's eradicated in the developed world, but it's been more difficult to eradicate in the developing world. So palliative care is used to treat many of the symptoms. In the acute phase, you're going to have like muscle spasms, headache, and associated discomforts that can be alleviated by simple pain relieving drugs. Respiratory failure, of course, is going to require ventilation. You're going to need physical therapy as soon as the acute phase is over to retrain those muscles and prevent prolonged crippling. Prevention is the most important. This is going to be vaccination. 4 doses normally, starting at 2 months of age. Adults traveling outside of the U.S., members of the armed forces can also be vaccinated. We have 2 vaccines, okay? We have the inactivated polio virus. This was developed by Jonas Salk in 1954. That is, then we have the oral polio vaccine that was developed by Sabin in 1960s, and that contains an attenuated virus that can sometimes revert to the neurovirulent strain and can cause disease. And so it is a little more dangerous vaccine, but it's much more dangerous to actually have polio. So the Salk IPV has a fully inactivated virus that is attenuated, so it has reduced virulence, but it's still viable. That's OPV. The OPV is attenuated. IPV must be given by shot. OPV is the oral. All right. It can revert back to, I already said that, non-virulent strain. Developing countries will get the oral polio vaccine. And here in the U.S. now we get the IPV. It's a little safer. And so it's only been recently that they've changed that here. I'm not sure exactly the timeline because my children I know got oral polio, at least my older 2 for sure. But like I said, it kind of depends on what your risk is. And it's kind of a risk-benefit analysis, but extremely important to get this vaccine. So we have 2 amoebas that can cause Meningoencephalitis, Naegleria fowleri, and one we already mentioned, Acantha amoeba. These are parasites that invade the body in very unusual circumstances. So first is Meningoencephalitis. This is going to be often something that happens when people are swimming in a lake, a natural body of fresh water. It often will go in through the nasal passages while you're swimming, and this can cause that primary amoebic meningoencephalitis. Amoeba can be forced into those nasal passages, like if you go underwater, and then they burrow down into the nasal mucosa and multiply, and then migrate to the brain and surrounding structures. Primary amoebic meningoencephalitis causes massive destruction of the brain and spinal tissue. It can cause hemorrhaging and coma and death within a week. So this is rare, but it can be devastating. We had a little girl in the Little Rock area actually die of this, I want to say somewhere around 10 years ago. So it has a wide distribution in fresh bodies of water. You can find it. It's just rare for it to actually get in, okay? And so it's actually very common as a harmless biota, especially during the summer months. It's just a series of events that leads to infection. That series of events is very rare. So prevention and treatment, it advances so rapidly that treatment is pretty much futile. It just doesn't do any good. Early therapy with amphotericin B, sulfadiazine, or tetracycline in some cases, or some combinations, can help a little bit. But like I said, once you find out you have it, it's almost futile to do anything. So this is one of the reasons why swimming pools and baths are chlorinated and checked periodically for amoeba, okay? So acanthamoeba causes a meningoencephalitis similar to Meningoencephalitis. The course of infection is going to be longer, and it can cause a granulomatous amoebic meningoencephalitis, okay? So granuloma is forming there. This can be spread via direct contact. What happens is it can invade the broken skin, conjunctivae, sometimes the lungs, and occasionally urogenital epithelium. People with traumatic eye injuries, contact lens wearers, and AIDS can be exposed to contaminated water. Those are going to be who is at risk. So acute encephalitis. Encephalitis is inflammation of the brain. It can be acute or subacute. It is always serious. The tissues of the brain are very sensitive to damage by those inflammatory processes, as we have already discussed. So almost always acute encephalitis is going to be caused by viruses, by vector-borne insect viruses, arboviruses like West Nile virus, okay? Others are like JC viruses and viruses in the herpes family that can be causative agents. Bacteria can cause encephalitis, but the symptoms are going to be much more pronounced in the meninges than they are in the brain. So symptoms are going to be convulsions, paralysis, or coma in a severe case. We're going to have Eastern equine encephalitis with a very high mortality rate is a problem, especially here in this area. It can also be caused by the JC virus, West Nile, Herpes simplex, California encephalitis. You will see behavior changes and confusion occurring because of the increased inflammation in the brain, then decreased consciousness and seizures may follow. And of course, these symptoms of meningitis will also be here. And so there's treatment with acyclovir if they think it is herpes virus. And that's not going to do any harm if they have another agent. So sometimes that is done just based on if they think it's possible that that's what it is. So arthropods as vectors. We have a lot of arthropod-borne viruses. These vectors actually feed on the blood of the host, and so they transmit their pathogen as they're doing so. Peak incidence of infections from arthropods are going to be, of course, when they are out. So this time of year, while they're reproducing, late spring, early fall. Warm-blooded vertebrates maintain the virus during cold and dry seasons, okay? Humans are going to be the dead-end accidental host of things like equine encephalitis or maintenance reservoir for things like yellow fever. Equine encephalitis is very dangerous for horses. That's what equines are. And we have a yearly vaccine for that. I give all of my horses get that shot. So it's not going to make you terribly sick, but it can kill your horse very quickly, okay? So for humans, it is believed that millions of people actually get arboviruses infections this year. Thousands can die. A common outcome is acute fever, accompanied by a rash. Symptoms and management of encephalitis caused by these different arboviruses are actually quite similar. So the transmission and of the individual viruses, however, is what is different. So it's going to begin with an arthropod bite, release of the virus into the tissues, replication in lymphatic tissues. All arboviruses can be transmitted by mosquitoes. All right, so arboviral encephalitis, this is a prolonged viremia as it is getting established in the brain. You can have inflammation and swelling, which will damage the brain, nerves, and meninges. Symptoms can be quite variable, including coma, paralysis. You can have convulsions, tremor, loss of coordination, difficulties in speech, and even personality changes. Some can actually experience a degree of permanent brain damage due to this. Of course, the young children and the elderly are most sensitive. People who are infected can often show no symptoms. Some people. The best defense here is vector control, controlling those mosquitoes. So diagnosing or detecting an arboviral infection can be difficult. Patient history needs to be obtained. Check to see if they have traveled to endemic areas or had contact with vectors. Serum analysis can be useful. Rapid serological nucleic acid tests are available for some viruses. There's not a whole lot of satisfactory treatment for any of the arboviral encephalitis infections. Okay. Palliative care is the mainstay. That is treatment for controlling fever, treatment for convulsions, dehydration, edema. All right. The safeguard is going to be at taking care of those vectors. Mosquito control, mosquito abatement, eliminating breeding sites, dumping over large areas of pooled water. Broadcast spreading, spraying for mosquitoes, insecticides. Very effective in urban settings. Okay. All right, moving on to herpes simplex virus. Here we've got 1 and 2, and again, remember to pay attention to the numbers, okay? This can cause encephalitis in newborns that are born to HIV-positive mothers. It has a very poor prognosis. Older children and young adults, as well as older adults, can be susceptible to encephalitis caused by HSV1. This is going to represent an reactivation of dormant HSV on the trigeminal ganglion. That's what the encephalitis is going to be caused by. We've already discussed varicella zoster virus can reactivate from the dormant state and is responsible for a few rare cases of encephalitis. The diagnosis is going to be via clinical presentation, although we can do a PCR antibody test or cell culture of the virus to confirm that. Treatment is going to be with acyclovir, and we do see about 3 million cases a year. So the JC virus gets that name because the patient had those initials that it was first diagnosed in. We have serologic studies that let us know that it's going to be sometimes an asymptomatic infection that occurs quite frequently. Serologic studies let us know that it is very common. So we can diagnose this with a polymerase chain reaction of the CSF fluid. There is no prevention. You can treat this with some antivirals. It's seen in immunocompromised patients in AIDS. It can be very severe. It's also can be progressive in what we call multifocal leukoencephalopathy. That can develop in patients that have immune dysfunction, especially those with AIDS. And it affects about 5% of adults with untreated AIDS. It's uncommon, but it is very generally fatal. It's often fatal. So the JC virus can attack the accessory brain cells and cause demyelination of certain parts of your cerebrum. And a few deaths have actually been found to be prevented by treating with zidovudine. Okay. Subacute infections of encephalitis will take longer to show up and are less striking in their presentation than acute encephalitis. This can be caused by Toxoplasma gondii, persistent measles infections, prions, and a variety of other infections with symptoms elsewhere in the body. All right, so let's do an Nclex prep question. Take a break from all this long list of pathogens. An infectious disease team is analyzing the epidemiology of vector-borne diseases, including those transmitted by arthropods. All of the following are arboviral diseases except what? A, polio, B, West Nile, C, yellow fever, or D, St. Louis encephalitis. Hopefully you came up with your answer of A, polio, because that is fecal oral en route, not vector-borne. All right, so Toxoplasma gondii. This can be an infection in a fetus. It also occurs in immunodeficient people. It can be severe and often fatal. And so most cases are going to be asymptomatic with mild symptoms like a sore throat, lymph node enlargement, low-grade fever. Recent data shows that infection in otherwise healthy people can actually have profound effects on the brain. People with a history of toxoplasmosis are likely to display thrill-seeking behaviors and have slower reaction times, which is very interesting. Most cases are going to be asymptomatic, although we will have those mild symptoms discussed a moment ago: sore throat, lymph node enlargement, low-grade fever. Patients with immunosuppressive activities can, due to cancer, drugs, etc., do not fare well. You can have a chronic or subacute encephalitis that occurs with extensive brain lesions. Disruptions of the heart and lungs can be fatal. Pregnant women have a 33% chance of transmitting this infection to the fetus. This is one of the reasons why pregnant women should not have a cat in the house. They should not be cleaning out a cat litter box, and you should not have a cat litter box in the house because you can actually have toxoplasmosis due to this, and it will give you a mild illness, but it can be devastating to your unborn fetus, okay? It can cause stillbirth. All right, liver and spleen enlargement, liver failure, hydrocephalus, convulsions, damage to the retina causing blindness. All right, my mother actually contracted this, and my brother is legally blind in one eye because of this. So this is an obligate intracellular parasite. Obligate, it is obligated to stay inside the cell of another creature that can invade the host cells. And so the parasite can undergo, has kind of complex lifestyle. It can undergo a sexual phase in the intestines of cat and then be shed off in cat feces, and it then becomes an infective oocyte that is going to survive in moist soil for several months, and then it can produce a cysted state in tissues. It can transmit then to oocyst, which can then be spread to the intermediate host, like a rodent or a bird. Okay, the cycle will continue when the cat eats that infected prey. We've actually discovered that the protozoan gets into parts of the rat brain that directs the rat to avoid cat urine. Okay, so when Toxoplasma infects rats, they no longer are afraid of cats and no longer avoid them, which is really crazy. And then the cat eats the fearless rats, and that ensures that Toxoplasma gondii is spread. All right, crazy, crazy, crazy. So humans are constantly exposed to Toxoplasma, and I cannot reinforce enough the importance that a pregnant woman should not handle cat feces in any way, shape, or form. They don't need to be in the house. Okay, so I'm sorry, boot the cat out. So 90% of the population has actually had exposure to Toxoplasma. And like I said, if you get it when you are not pregnant, it's not that big of a deal. But if you are pregnant, it can be devastating. It can cause stillbirth, which is, if you don't know what stillbirth is, a stillborn baby dies before they are born, and then you have to deliver them, which is just horribly traumatic. You can also get this from raw or undercooked meat, handling of cat feces, just inhaling the dust of infected cat droppings. So that's why I just say, just kick the cat out. Sorry. I'm an animal lover. I have cats, but when I was pregnant, they were not allowed in the house. Okay. It's the taxozoite form of that can actually cross the placenta to the fetus. And so hygiene is extremely important in the control of Toxoplasma. Cooking or freezing meat, hand washing after handling cats or feces, just don't do it if you're pregnant. 15% of people are seropositive. That means they have already been exposed, okay, if they've been tested. So sometimes the measles virus can cause subacute sclerosing panencephalitis, okay? It's a persistent infection. This is a slow virus infection. Symptoms can appear after an initial measles episode and are different from those of immune-mediated post-infectious encephalitis. Say that 10 times over fast. Seems to be caused by direct viral invasion of neural tissue, and it doesn't have very effective treatment, and it's almost always fatal, if not always. It's not really clear what factors lead to persistence of this virus in some people, but diagnosis occurs via EEG, MRI, or serology test, and it's more commonplace than we once thought. Next, we have prions, which to me are kind of the most fascinating. They're also the hardest to treat because they are basically just infectious proteins. They're not bacteria, they're not viruses, they're just proteins that don't work right and have become infectious. It's really weird. So we have prion stands for proteinaceous infectious particle. It does not contain any genetic material, okay? The diseases we see are things like sheep's scrapie, Creutzfeldt-Jakob disease, bovine spongiform encephalopathy, which is mad cow disease, Kuru, not going to try to pronounce Gerstmann-Straussler, I think. It's kind of a new one for me. Schnecker disease, fatal familial insomnia. Okay, and this is where you actually cannot go to sleep and you die. If you don't go to sleep, you can actually die. It's hereditary, fatal familial insomnia. Okay. So it can cause the transmissible spongiform encephalopathies, and it's a group of neurodegenerative diseases that have a long incubation period, but a very rapid progression. Okay, so the human transmissible spongiform encephalopathies include Creutzfeldt-Jakob, Gerstmann-Straussler, Schrenker disease, and fatal familial insomnia. Animal transmissible spongiform encephalopathies are sheep scrapie. You can also see it in goats. Transmissible mink encephalopathy, bovine spongiform encephalopathy, which is our mad cow disease, okay? They have found some association, we don't quite understand it yet, of prions with things like Alzheimer's and Parkinson's disease, which is very interesting. I would like to see some future research in that area. All right, so let's look at these prion diseases here. So prions cause a transformation or a change of a normal host protein. And here we're looking at, I think this is sheep scrapie. Might be bovine spongiform encephalopathy, but I think these pictures are from sheep scrapie. And so you have a normal host protein, which is PRP. That functions in normal brain development. And what happens is a mutation can cause a structural change in the protein, making the PRP, the normal version, mutated, and then they're able to convert other proteins into their abnormal form. And so it's kind of self-propagating chain reaction that leads to an accumulation of the abnormal PRP, which causes plaques. Okay, so this is why they're thinking Alzheimer's. Alzheimer's is associated with plaques and tau tangles, and then also spongiform damage, which means holes in the brain, which is what you see in this picture over here to the right. These big round spots, holes in the brain. So big Swiss cheese think is what your brain can wind up looking like, okay? So prions are transmissible agents. So they can be acquired through transmission. You could actually have genetic mutations of the PRP gene, which can be passed on as a hereditary trait. But prions, while they're not the same as like a virus or a bacterium, they are hardy pathogens. They're resistant to chemicals, radiation, heat, prolonged autoclaving, okay? And And what one interesting thing they found out was Creutzfeldt-Jakob disease, which they thought was only inherited, actually they found can be transmitted physically. And they found this out in a terrible way. They were doing surgery on one patient that had one form of I guess that patient had Creutzfeldt-Jakob, and they sterilized their equipment, or thought they did, and worked on the next person. They were doing brain surgery, and that next person actually got Creutzfeldt-Jakob from the previous patient. And so this has led to changes in our sterilization and disinfection. Sorry, I've got a hair here. Disinfection procedures, okay? And so we have found that vehicle transmission can occur as well. Diagnosis is really postmortem via brain biopsy. Biopsy is okay. Postmortem means after death, so that's when you can really definitively diagnose, is what I mean by that. You're going to see altered behavior, dementia, memory loss, impaired senses, delirium, premature senility, becoming senile at an early age. Uncontrollable muscle contractions can continue until death. Okay, which usually occurs within a year after diagnosis. Okay, people with Creutzfeldt-Jakob can actually live less than a year often post-diagnosis. So we had an occurrence of this in the 90s, not Creutzfeldt-Jakob, but of we had cattle that was affected with bovine spongiform encephalopathy, and people developed Creutzfeldt-Jakob, which is the human version, after eating contaminated meat. And so this happened in Great Britain, and so many cows were found with BSE, and they had to put down just herds and herds and herds, thousands of cattle because of this. Creutzfeldt-Jakob has two variants. It has a virulent form. The virulent form, the median age of death occurs at 28 years old. Okay. If you have the normal variant of CJD, then your that median age of death is about 68. So there is one really virulent, we could say, form that can cause very premature death. So it has a very long incubation period, but once it starts, it progresses very, very quickly. Okay. And so we need to be aware of that. If somebody has this, you need to be very careful with contamination of surgical instruments. And they've actually made disposable surgical instruments now that they use during brain surgeries and things. Because the normal disinfection and sterilization procedures just don't work with prions. Okay. Next, we have rabies, and rabies is another zoonotic disease. This is very, very difficult to get rid of because the reservoir, and I may be getting ahead to another slide, but the reservoir is so many different species: rats, armadillos, bats, dogs, cats, horses, people, anything can get rabies, so we cannot get rid of it. This is a slow and progressive disease that causes a fatal encephalopathy. It has a very distinct pathogenesis and very distinct symptoms, okay? It will start with anxiety and agitation. You'll have muscle spasms, convulsions, and paralysis. You will have that foaming at the mouth. Incubation period is going to be 1 to 2 months, sometimes more. Depending on the location. If it is in the facial, scalp, or neck wounds, it has closer proximity to the brain, so it will have a shorter incubation period. You have a prodromal phase that begins with a fever, nausea, vomiting, other non-specific viral type symptoms. And we think of rabies and we just think of dogs and getting vaccinations, but this is fatal if it is obtained by a human. This is fatal for anything. It is very, very rare to, in fact, up until very recently, we haven't known anybody to actually survive rabies. I want to say the last I looked, there was 5 people ever that survived rabies. Okay, so this is not something to play around with. So as I said, this is definitely zoonotic. We will have lots of reservoirs. They're usually going to be a wild mammal, skunks, canines, we already said, coyotes, wolves, raccoons, badgers, bats, cats. Both wild and domestic animals can spread the disease. Getting these rabies shots are really, really important, okay? We've had some cases of rabies, I know, of horses, just even in the decab area in the past 10 years. All right, so it's very important to get those rabies shots. They're very cheap and a very easy way to prevent spread of this disease. So the annual worldwide total for human rabies is estimated to be about 35,000 to 50,000 cases. We only, thankfully, due to vaccinations, have a very tiny number of these occur in the U.S., okay? Usually this occurs due to bat bites because we can't vaccinate bats, or I guess we could, but it's probably not very easy. And so, let's see. There are some regional differences as to whatever the dominant reservoir is. Like in California, it's primarily skunks. In the East, it's raccoons and Texas foxes, but it can be anything. And so this requires multiple tests to diagnose. You can use a reverse transcription polymerase chain reaction with some saliva samples, and then that's going to be accompanied by detection of antibodies to the virus in the serum or spinal fluid. Okay, skin biopsies, I think I said that kind of wrong, can sometimes be used. Dog rabies has declined a lot, but wild or stray animals can be a problem, okay? So you've got to have meticulous care of the wound with a bite. Any animal bite is really very dirty and very prone to infection, especially cats. But you need to clean that very well. Debride the wound, wash it up very good with soap. They will infuse it with human rabies immunoglobulin. Post-exposure, you're going to use a vaccination with an inactivated vaccine, okay? A full course of vaccination is then going to be started. High-risk group like vets, animal handlers, lab personnel, travelers, those should receive more doses to protect themselves, okay? There is a DNA vaccine in development for rabies. Okay, I think I have another slide on this. All right, so we're winding up this chapter here. We're looking at tetanus. Tetanus, well, that's commonly known as lockjaw, which sounds pretty benign, right? Lockjaw. Well, you know, I can't talk for a little while, which is a big problem for me, right? Because I talk a lot, obviously, or I wouldn't work as a teacher. But this is much more serious than that common name lets us know. And again, this is one of those things that's been around for a long time. And if we saw this in as commonplace as it used to be, we would not have these vaccination issues. People will be getting their vaccination. This comes in the DTP, which is now DTAP shot, T for tetanus. Diphtheria, tetanus, and pertussis, I believe, is the vaccination. This is caused by Clostridium tetani, which is often found in the soil. So this is why you can get it like you step on a rusty nail. It's kind of the classic thought of how you get it. Also in the GI tracts of animals, this is gram-positive endospore-forming bacillus. And you can see here on the end of this here, the endospore is kind of on the very end of it, okay? And it has a vegetative growth as well, okay? They kind of swell in the vegetative cell, the endospore does. And those are only produced under anaerobic conditions, okay? We would call that a terminal or on the end endospore. So when you think of tetanus now, instead of thinking of lockjaw, I want you to think of this picture. And I think I put the Civil War soldier picture on the next slide. I hope I did, because that is the one that I remember from when I was in school, and it's burned into my brain. And so it helps get rid of that tetanus being kind of a minor thing. It gets that out of your head, and you realize, whew, this is bad stuff, okay? So it is a very powerful neurotoxin that is released by Clostridium tetani, and that's going to bind onto peripheral motor neurons, spinal cord, and brain in the sympathetic nervous system. And this toxin is going to inhibit muscle contraction. And so instead of that flaccid paralysis, we have this I'm trying to think of the word now. It's not flaccid paralysis, but you're going to see this extreme flexion of the arms and muscle contraction, flexion by the arcing of the back and extension of the legs, and they are permanently stuck in this position. Okay, your muscles are basically stuck in place, and you can have what's called rhizus sardonicus, which is this grin that you get that is confirmed by lockjaw, which looks kind of like an eerie smile. But that's a very early symptom, okay? And usually you're going to have death occur, which is going to be because your respiratory muscles are going to not be working, your diaphragm, intercostal muscles. So tetanus is a little harder to get, which is a good thing. Endospores in the wound, just being there, isn't necessarily enough to cause an infection. So the bacterium isn't able to invade damaged tissues very easily. The organism's anaerobic. Endospores cannot become established unless you have necrotic tissue that have very poor blood supply. And so then the vegetative cell will grow and is going to release titanospasmin into the infection site. And that toxin is then going to spread, that's the name of the toxin, to the motor nerve endings and cause the blockage of the release of neurotransmitters, and so the muscles stay in contracted state. Okay, now it only takes a small amount of the toxin to initiate symptoms. So here is the picture of the Civil War soldier that died from tetanus. Okay, used to happen quite a bit. Thank God for the vaccine. We don't have to worry about this as long as we're getting vaccinated. Okay, and you do have to get boosters of those every 10 years. So if you hurt yourself, especially on something outside, I ride horses. I hit a barrel. I do barrel racing. I hit a barrel, and those are often very, very rusty. Cut my knee wide open. Well, what do? They make me get a tetanus shot. Did I argue? Heck no. I don't want to look like this. Okay. So I want this burned into your brain. Tetanus is not just lockjaw. Okay. This is a person that has the suggestive appearance of tetanus will be given antitoxin therapy. Okay. So if they think they have an antitoxin therapy, they're going to give human tetanus immunoglobulin, which is TIG, and penicillin G, okay? And then there's this recommended, of course, vaccination series with your DTP or DTAP. A 1 to 3 month old baby is going to get 3 injections, 1 to 2 months, every 2 months apart, followed by boosters at 1 and 4 years, and then every 10 years after that. And pregnant women should be vaccinated as well. So you can have a toxoid to persons who have never been immunized, it can be given, or if their booster was not within the past 10 years. That brings us to Clostridium botulinum. That was Clostridium tetani. This is Clostridium botulinum, and this is going to cause a flaccid paralysis, not the contractile type. And so this is an endospore forming anaerobic again, and it does produce an exotoxin. This is also found in the soil, sometimes in the water and GI tract of animals. It is distributed worldwide, but occurs most often in the northern hemisphere. Okay, so where do we live? There are 7 different types that vary in distribution in regions. Human diseases, you're usually going to see A, B, E, and F. Animal diseases, you're going to see A, B, C, D, and E. Okay, so the muscles cannot relax in tetanus, but they cannot contract in botulism. Okay, botulism is a foodborne neurotoxin, and it's botulinum toxin, and it can cause an intoxication. That's caused by the exotoxin. So this is associated with food preservation, and so the incidence of this has decreased some because we're no longer canning foods at home at the rate that we used to do. Okay, and so until recently it was very common, and it is very frequently fatal. Modern techniques of food preservation and medical treatment have decreased its incidence and fatality rate. We have 3 forms of botulism that can occur. They're distinguished by their means of transmission and the population they affect. So we have infant botulism, which is the most common type, accounting for 75% of cases. This is an infection followed by an intoxication. Raw honey is often the culprit, but we don't always know. And so this is why they don't recommend raw honey for very young children. And the reason for that is you have immature neonatal microbiota in the intestine, and that will cause a predisposition. And so you'll have this flaccid paralysis where you're just limp, which can cause a weak sucking response, and so lasts of muscle tone, and is kind of just called floppy baby syndrome. The normal microbiota in the GI tract of an adult will actually help to prevent this type in an adult. Then we have the foodborne botulism, which is pure intoxication, and this is seen with home food processing. The endospores can be present either before you preserve, the pressure cooker may not reach the appropriate temperature to kill the endospores, or the pressure cooker may not pull all the air out and cause an anaerobic condition. And so you won't see or smell or have any hint of a problem. You won't know there's anything wrong with the food or the bacteria have been present. And bacteria may actually no longer be present because remember, this is an exotoxin. So only the toxin has to still be there. And this is 20 to 30% of the cases, okay? And then you can have botulism in the wound, so wound botulism. This is, again, infection by intoxication. Endospores can enter a wound or a puncture wound, similar to tetanus, but the symptoms are going to be more similar to the foodborne botulism. This is actually on the rise with IV drug users, but only accounts for about 3% of illnesses. So the botulinum toxin is a neurotoxin that causes that flaccid paralysis, a loss of ability for muscle contraction. It can travel to the principal site of action, which is going to be the neuromuscular junction of skeletal muscles. It prevents the release of that acetylcholine, which is the neurotransmitter that causes muscle contraction. And so the result is that flaccid paralysis, which is the opposite effect of tetanus. Usual onset time before symptoms is 12 to 72 hours, depending on the size of the dose. So how much you get. Dose matters, okay? Early symptoms, you can have double vision, difficulty swallowing, dizziness. Later on, that will be followed by muscular paralysis, respiratory compromise, that type of thing. Now, interesting enough, you may have put this together, but this is what Botox is. Botox injections use the botulinum toxin to prevent wrinkles by inhibiting muscle contractions. Kind of not so good, right? In your face. But we also have found some alternative treatments for this that are a little bit more important than wrinkles, which is going to be treatment for incontractable migraine, migraine that you can't get rid of. Urinary incontinence, not quite sure how that works. Seems like that's counterintuitive. I'm going to do some research on that one. Multiple sclerosis and some other things as well. So we've actually found some ways to put this to good use besides just wrinkles. Okay. And so the diagnostic standards are a little bit different depending on the presentation or which type of botulism it is. Okay. So if you think you have botulism, you need to call the State Health Department or the CDC before proceeding with the diagnosis or treatment. They maintain a supply of antitoxin that, if administered soon enough, can actually prevent the worst outcome of the disease. And they need to be managed with respiratory care, cardiac support, and hospitalization for all cases. Okay, it does have a 5% mortality rate with treatment.